This is one of the toughest decisions I've ever made as governor.
Governor Kathy Hochul is on board with a proposal that would make it legal for terminally ill New Yorkers to take lethal drugs. Announcing Wednesday, she will sign the Medical Aid in Dying Act once a series of changes are made to prevent abuse or coercion.
I've brought back some memories of my own story with my mom, and I was at her side when she was in her final months fighting a debilitating illness, ALS.
Hochul's new requirements include an oral request recorded by video or audio, adding a mandatory waiting period of 5 days between when a prescription is written and then filled, a mandatory mental health evaluation by a psychologist or psychiatrist, and limiting access to New York residents. Speaking to advocates and reflecting on her mother's death, the Catholic governor said she attended a funeral that helped deliver her decision.
My last thoughts were sitting at a funeral, a Catholic funeral, Saturday morning, this past weekend, and I heard the priest talk about being called home to eternal life, not in a hospital bed with strangers at a time when they just slip away after grueling pain.
It also requires approval from medical professionals, bars anyone who may benefit financially from the patient's death from serving as a witness or interpreter, and eligible individuals must be diagnosed with 6 months or less to live. But opponents say
the fact that she introduced amendments to this policy demonstrates that she knows how dangerous the core of the bill is.
The New York State Catholic bishop said in a statement, quote, "This new law signals our government's abandonment of its most vulnerable citizens, telling people who are sick or disabled that suicide in their case is not only acceptable, but is encouraged by our elected leaders."
What we see in this policy is a scenario where we are making it easier for patients who want to access treatment but cannot afford to access instead lethal drugs.
But the measure won't be signed into law before January 1st. The Democratic-led state legislature must pass the bill again before Hochul can sign it into law. And after that, it will be 6 months before eligible New Yorkers may access the medication.
In this process, lost my sister and lost my mom. It's at the very end that you have excruciating pain. Up till then, it's manageable. You live your life. It's really at the end.
This is something that is popular among constituents. Personal liberty, bodily autonomy, issues of conscience. Those are issues that I think voters understand pretty clearly.
Advocates argue they should have the choice.
A year ago, I was diagnosed with stage 3 prostate cancer. It came out of the blue, a shock, and so there is a level of urgency with this legislation.
New York would be the 13th state to sign the measure into law. Bernadette Hogan for New York One.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.